Hi, my name is Dominique Andrews, and I'm doing my presentation on eating disorders, particularly bulimia nervosa. Bulimia nervosa is characterized as recurrent episodes of binge eating with the following characteristics. Eating in a discrete period of time, an example would be within any 2-hour period. Food larger than most people would eat during similar period of time. Also, secondly, since there's a lack of control of overeating during the episode, it would be followed by feeling that one can't stop eating or control what and how much to eat. The second diagnostic criteria, according to the DSM-4, is recurrent inappropriate behavior to prevent weight gain. This consists of self-induced vomiting, misuse of laxatives, enemas, diuretics, fasting, and excessive exercise. The third criteria is binge eating and other behaviors that occur both and at least twice a week for 3 months. The fourth diagnostic criteria is self-evaluation influenced by body shape and weight. And then finally, disturbance does not occur during an episode of anorexia nervosa. Now, there are 4 types of treatment options for bulimia nervosa. The first one is cognitive behavioral therapy. Cognitive behavioral therapy helps a person with bulimia nervosa process or realize all those negative thoughts that they may have about their ideal body image or their shape or their weight. It also helps to process or get out any feelings one might have towards that could be pushing them towards having the binge eating or forcing them to purge. Then you have interpersonal psychotherapy. Interpersonal psychotherapy has the client look at specifically things in their daily life that could be contributing to them, causing them to have the binge eating or the purge eating. Then there's family-based therapy. This is used particularly for families that may have teens or children that are diagnosed with bulimia nervosa. And it helps the family as a whole be able to figure out the dynamics of the family, things that may have pushed a client towards the bulimia nervosa. Then finally, there's medications. Medications typically is the first route of therapy, and usually there's an antidepressant that's usually given to clients, and it's typically Prozac. Medications usually is the first course of treatment, followed by cognitive behavioral therapy or the interpersonal psychotherapy, and then the family-based therapy. Now, let's think about a case scenario. You are working as an intern for a psychologist, and the psychologist has diagnosed a 17-year-old girl with bulimia. The client still lives with her parents, and the client states that her parents are very overbearing and have been nagging at her to diet for the upcoming gymnastics competition. The client says she can't take any more and just wants to run away from it all, but she feels she has an obligation to represent her family well because they are well known and one of the most popular and wealthiest families in their community. The psychologist asks you for help in brainstorming the course of treatment. What action could you suggest? So we will come back to the case scenario. At this time, you will have time just to think about some of those treatment options in your course of treatment that you would take, considering that this is a 17-year-old girl that has been diagnosed with bulimia. Now, The treatment options for the case scenario, and of course you could think more, would be first off medicine, because it does treats the binge, the purge cycles, and should depression form from the bulimia, then the medicine would also help to treat the depression as well. The cognitive behavioral therapy, again, is to help the client understand triggers that cause the binge eating so that these triggers possibly can be reduced. Then the interpersonal psychotherapy, this helps the client identify any relationships connected to the binge and the purge eating. And then finally, there's family-based therapy. We have to take into consideration that with family-based therapy, complications may arise from this therapy due to the parent's pressure that's already placed on the client. Now, the true definition of bulimia nervosa is that it's a serious eating disorder marked by binging and followed by methods to avoid weight gain. The behaviors that are used to compensate for the overeating is forced vomiting, gagging, a high use of laxatives or diuretics, fasting, and extensive exercise. The symptoms of bulimia. Anyone that's diagnosed with bulimia nervosa more than likely will have the following symptoms. They will have an inflamed sore throat. The salivary glands would be swollen in the neck and the jaw. They would also experience acid reflux, irritation of the bowels due to the abuse of laxatives, dehydration, abnormal levels of minerals such as sodium and calcium, and also worn enamel of the tooth and decay of the teeth due to the exposure of so much stomach acid. Now, the history of bulimia nervosa goes all the way back around 700 BC, in which there's evidence that it went back to the 1st century during this time. Usually at this time, the Romans, this is during the era of Caesar, but the Romans would have big lavish banquets. And of course, there would be plenty of food. So everyone, the Romans would eat and have a good time. But then they also would kind of pay attention to their, body image or weight, to where they would, after they would eat the first round, they would actually have a round of self-inducing vomiting so that they could go back to the banquet later and be able to eat more and enjoy themselves. Then also there's ancient Egyptians who would draw hieroglyphics that indicated that there was monthly binge eating in their way of helping to avoid illnesses at that time. Now, the causes of bulimia, there's certain risk factors in sociocultural, biological, and psychological. For the sociocultural and psychological factors, the risk factors include having low self-esteem, pressure to lose weight and be thin, cultural norms, basically what's attractive and what's not in your culture, and if there's also a history of sexual abuse. The biological risk factors is basically having a genetic predisposition to eating disorders and a deficiency of brain chemicals or neurotransmitters such as serotonin. Now, there are long-term effects of bulimia on the organs or systems of the body that are affected. You have bulimia can affect cardiovascular, it can cause heart damage. Also, the digestive system, in which we talked about earlier, it can cause acid reflux. You have the excretory system that it can affect, the skeletal system. It also can affect the reproductive system, particularly women. So women that are diagnosed or happen to be diagnosed with bulimia nervosa, it can cause damage to ovaries, which in turn can make it harder for women to have children. And then also, bulimia nervosa can cause damage, of course, to the nervous system.